My name is Michael Krausz. I'm the UBC Providence Leadership Chair for Addiction Research at the University of British Columbia and the chair of this conference. And I'm really happy to welcome you to this, we think, very important event. The huge interest of 2,100 participants is really documenting interest and documenting also the passion a lot of people having for this conversation. Before we start, I want to acknowledge the land we're working from and gathering from here in Vancouver. It's the traditional ancestral unceded territory of the Musqueam and Coast Salish people. And as I mentioned also, we are joining from different parts of our country and different parts of the world. I also want to use my little introduction to acknowledge the engagement and the passion of a lot of people organizing this event with several keynotes, 35 breakout sessions, all kinds of interactive things. So it is a common effort, and it's an effort where everybody involved is absolutely dedicated to make a difference. So it's my great pleasure now, in order to start the event off, to welcome Lynn Pelletier. Lynn is Vice President for BCMHSUS, which is the Mental Health and Substance Use arm of the Provincial Health Authority in British Columbia. They are a great partner in all these endeavors and doing especially very important work for people with complex concurrent disorders and in the tertiary care sector. And we are very lucky to have Lynn here to welcome our event. Lynn, the floor is yours.
So thank you, Michael, and hi everyone on an early morning. First of all, I'd like to respectfully acknowledge that I'm calling in today from the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm so happy to be here today and provide some opening remarks for the conference. This is such an important topic and it needs our renewed attention. Unfortunately, amid the chaos of the COVID-19 pandemic, the significance of the overdose crisis has been overshadowed. And yet it continues to ravage our communities and the people of BC, as well as in Canada and around the world. So this conference, I think, comes at a very good time as we emerge from the global pandemic and start to rebuild and refocus and regroup and draw our attention to this hidden pandemic and discuss ways that we can work together to implement change. And why is it important? I mean, I think all of us know that, but just a few of the more recent facts. Drug use is directly and indirectly responsible for 11.8 million deaths each year worldwide. Over 1,700 people died in BC alone last year from overdoses due to the illicit drug supply. And that's up 74% from last year, and it continues to grow. This year to date, 680 people have died up to the end of April, according to the coroner's report. Smoking, alcohol, and drug use is an important risk factor for early death and disability, and more than half of the people die from alcohol or drug overdoses are younger than 50. And serious substance use obviously is also often associated with mental illness. And we see many people in our services that have concurrent disorders. There's also increased risk of homelessness, criminal justice involvement, and hospitalization. So clearly we have a serious problem in BC and around the world. Throughout the pandemic, we've seen an increase in people experiencing both mental health and substance use challenges. And this, combined with the lack of access to services, has exposed the cracks in our system, including a lack of publicly funded evidence-based services and supports at all levels. It's also exposed the inequities in our society and exaggerated the challenges for the most vulnerable clients and complex populations. So this is not a new problem, as we all know. It's been a growing problem for years. And over the past few years, we have established many urgent, where there's been an emergency declared, we've had planning tables, we've funded new initiatives, but clearly addressing this devastating situation is proven to be extremely complicated and multifaceted. So today, Michael and the UBC team are bringing together the best minds in the province, as well as national and international speakers and participants. And there sounds like there's many thousands of people, and it's very good timing for this. We've all been so focused on the pandemic over the past year and a half. As we start to emerge and hopefully reach the other side of this, we need to turn our attention to this really important work and to build on some of what we've learned during the pandemic as well about addressing social inequities, about increasing access to services, including using virtual innovations. And I'm sure we'll all agree that the status quo is not an option. So I look forward to hearing the diverse and impressive range of speakers that are participating today, from clinical professionals to policymakers, senior leaders, academics, people with lived and living experience, and others. It's a great opportunity to reignite this work that we're doing collaboratively to discuss new ideas and set the stage for innovation. So thank you.
Yes, thank you very much, Lynn. Now it's my great pleasure to introduce our Minister for Mental Health and Substance Use, Honorable Sheila Malcomson, obviously from her lovely home and home office. It's our great pleasure that she is welcoming and addressing our conference in the very beginning. The floor is yours, Minister.
Thank you so much for the introduction and the invitation. I'm grateful to be speaking with you from Snuneymuxw First Nations territory, the sun beaming in the window. Thank you for inviting me to help open this extremely important conversation about the poison drug crisis. Thank you to the organizers of today's event and all those working to support people who use substances. We know where we're starting from. Last year, as Lynn has summarized, a record number of people lost their lives to poisoned illicit drugs, a year when drugs became more toxic than ever. People in BC have been caught at the intersection of those two public health emergencies, COVID-19 and the overdose crisis, each having a devastating and ongoing effect on each other. We know 40% of Canadians say that their mental health has deteriorated since the pandemic's outset. And some suggest that that's a conservative number, warning of that shadow pandemic of mental illness following this unprecedented time. Isolation and trauma are at the root of mental illness and addiction, as we've been reminded in recent weeks as lost ones in unmarked graves have been confirmed at residential schools. This is underscoring the impact that colonialism, past and present, has on Indigenous people disproportionately harmed in the overdose crisis. After the devastating year that we've had with unprecedented deaths due to the poison drug supply, it's heavy work that you're called to do. And I recognize these immense losses that many of you have lost peers and allies in this terrible year. I am sorry. Seeing such a group of people coming together today with solutions in mind, health experts, policymakers, researchers, students, all those working every day to help save lives, the frontline workers, the advocates, the people with lived and living experience. I'm filled with resolve and also hope. I know together we can move mountains. And I know this because before COVID-19 hit, BC was moving in the right direction. That in 2019, overdose deaths dropped for the first time in years. Even up to February 2020, overdose deaths were dropping in British Columbia. That's because of all of our combined efforts. They made a difference before the pandemic and they will again. They must. Working with key partners across that continuum of care, our government is tackling the drug poisoning crisis from all angles. In just 4 years, we have made a lot of change. No illusion, there is so much more to do, but I do want to describe a little bit some of the comprehensive system of mental health and addictions care that we've been working to build from the ground up. building that system while fighting 2 pandemics. The pathway to hope is our government's plan that provides that roadmap. From harm reduction to treatment to recovery, we're building up all the components of care and introducing new linkages from one to the next so that every door is the right door. That is why we've increased the number of overdose prevention and supervised consumption sites from 1 site in 2016 to the 38 we have now. And we're adding more in every health authority, including inhalation sites, particularly important at this time. It's why we're doubling the number of youth treatment beds, doubling them, and adding hundreds more adult treatment beds, and expanding access to prescribed safer supply. As of March 2021, there was a 475% increase in the number of people receiving hydromorphone compared to February 2020. And there is significant expansion coming on prescribed safer supply, which we will announce in the coming weeks, thanks to some of you in this conference today who have helped shape that work. Medication-assisted treatment is expanding too. Over 24,000 people, more than ever before, are receiving medication-assisted treatment in BC, with 1,690 prescribers, clinicians prescribing OAT each month as of March 2021. And now nurse prescribers are also helping more people access medication-assisted treatment. BC is the only place in Canada where nurses have been given this expanded scope of practice. And we're grateful to the 80+ nurses who have either already trained or registered for training since 2021 began. Especially rural and remote regions will benefit from this expanded service delivery, where the lack of a prescriber has been a barrier to accessing medication-assisted treatment and other ways to separate people from the toxic drug supply. Also, we're the only province working to combat stigma by decriminalizing people who use drugs. We're pursuing decrim with our federal partners, and this follows on my colleague, Public Safety Minister Mike Farnworth's direction to police last year, and Premier Horgan's request to the Prime Minister a year ago. This is because we affirm that substance use is a health issue and not a criminal one. And breaking down the stigma around people who use drugs can in and of itself save lives. BC is at the center of Canada's overdose crisis, and we are trying new tools that are Canadian first, leading the country when it comes to making innovative, groundbreaking change. When I reflect on this past year, a year of global pandemic and unprecedented overdose deaths that brought people together through collective loss, tragedy, and hardship, I see the other side of the coin too. Hugely expanded understanding of the drug toxicity crisis, deep respect for the leadership of public health, recognition of healthcare and frontline workers' heroic commitment. And I hear again and again that the preciousness of connection will never be taken for granted again after the year that we've had to stay apart. So it is time to move forward together with that greatly broadened community support in new and better ways to save lives. Thank you for your work, your partnership and expertise. We're grateful for and reliant on your service. I wish you the most successful conference. Thank you for your work.
Thank you very much, Minister Malcomson, and much success with all the positive initiatives you mentioned. It's my pleasure to introduce a good friend and colleague, the chair of the Scientific Advisory Board of the Canadian Centre for Substance Abuse, Franco Vaccarino, who is joining us from Ontario, and the floor is yours, Franco.
Wonderful. Well, thank you very much, Michael, and thank you, Minister Malcomson, for those remarks and for connecting the dots in important ways as well. Lynn Pelletier for your comments, similarly connecting important dots for us all in this broad, complex time that we're living in. Let me say I'm absolutely honored to participate in this conference and to bring these welcoming remarks. This conference is a reminder that with all of its complexities and scientific nuances, the opioid crisis and this conference is also a reflection of our common humanity. And I say this because it's really an opportunity for all of us to come together and examine the opioid crisis through our various and different lenses. This conference highlights our common purpose. We come from different places, but we're converging on this common purpose, and ensures that we not only learn from each other to advance our understandings and continue to move forward with solutions, but that we also make sure that these solutions and insights continue to inform our system approaches. Let me also give a shout out here to Dr. Krausz and his team, the conference organizers. While this conference is happening in what I would say are difficult times, certainly at so many levels, it's amazing to me how we're able to come together in new and powerful ways. So thank you again for putting together this excellent conference. And we talk about virtual versus real, but it's always striking to me some of the opportunities and advantages actually of being virtual, and how things can be corrected online in real time as we go through the hiccups of our various meetings. And so thank you to the organizers really for doing a great job. Now, I think one of my additional duties now is to introduce a video. So it's my pleasure to kick things off by inviting everyone to watch this short video. Now, the video features a local artist, Smokey D. Smokey D is not only an advocate, but also the creator of the impressive street art featured in the conference's promotional materials. So over to you, and now the video.
Thank you.
Yeah, hi, my name's Smokey D. I'm from the infamous East Vandals, and I've been doing graffiti down here in the hood here for 25 years. This year was a very serious year for me. I never experienced anything like it, right? At the end of it, out of the 914 people that died, I knew 21 of those people really well, right? And that's a big chunk of friends to take on 1 year, right? It's what I'm here for, if everyone else has a job or whatever, I think this is my job as well, right? I like to represent all of us, right? And represent people that society forgets about or doesn't look at, you know what I mean? I try and paint a lot of places where people usually get high or something like that. So maybe if they're just before they do it, they'll have a look at it and think, the world's a better place with a lot of in it, even though they may feel alone at the time. I'm not gonna sugarcoat it or whatever. A lot of those people were criminals or drug, people that have no family or anything anymore, right? So they don't really have anybody. So when I do the memorials for them, I make sure I do nice big murals for them, so society may not forget them. You know what I mean? Yeah.